So this bit is about, how do you choose who to send your patients to, and find supports for your patients. And I mean, there's a beautiful example there from Franziska already. Who do you reach out to when you're not sure what to do? In her case, an endocrine nurse was able to help her out with working out how to do a test. So guys, yeah, Tatsuo, perhaps we'll start with you. How do you go about referring patients, and who do you choose to refer them to as a GP?
So that's a tricky question, to be honest, because I don't think I'm very good at, especially good at, this section. But one thing I remember, and I am thankful, is that when I first, started the one GP clinic in a regional remote town in Queensland, one of my colleagues actually brought me to the hospital on the day one. And he actually introduced, ED doctors of the hospital. And, we greet each other, between GPs and ED doctors. And so that's really, nice way to introduce yourself to the local hospital. And that's, I think, very, polite way to introduce yourself. And I really, think that is a good idea. And I'm thankful to that colleague. So that's one suggestion I can offer. And but otherwise, talking to your colleague about who to refer to, or maybe you can do the research in the Google. So I'm sorry, that's very ordinary, way to find the, specialist. But I think I want to leave to Francis.
Sure. I mean, I guess one of the beauties of working in a more remote centre is referral networks are a little bit simpler, I guess. Sure. So, Francisco, any other suggestions about how our attendees can find out about the sort of referral mechanisms in their local neck of the woods, as they say?
There's lots of ways of finding out. So one thing that's super useful to join is the primary health networks. They tell you about local services, local programs, things to get involved in. So it's worthwhile Googling what your local primary health network, it's often shortened to PHN, is. The other thing that's very helpful is the local health pathways. So we have the Melbourne health pathways here. They are a mixture of local resources, but you can also find random things like what to do with abnormal LFTs or so on there. So very well worthwhile having a look and familiarizing yourself with them. I actually grabbed one of my fellow GP colleagues when I started, because we were both not very busy at the beginning, and just sat down with him for a few hours each day, and he explained to me what the local community house is, where to find physio, how to refer someone. And then it's worthwhile just having a look at your local hospital's website and see what services they offer. There's a difference between a private and a public health system, so maybe have a look at both of those in your area. And then one of my practices actually had a really useful list of frequently used specialists where everyone contributed. So people, we all generated a list together of specialists we had worked with and knew were good in an area. And we're just creating that at my current practice, even though I guess we've got more public health and community health rather than private health.
Yes, in fact, we've got a question from Gihan, which is similar to what you've just said. Do referrals depend on the patient's preference, private or public sector? I guess another way of putting that is, do patients always have the choice to go private, Francisco?
I think it's generally up to the patient. I generally talk to them about costs and waiting times when it comes to consider private versus public, but a patient can choose where they want to be referred.
Yeah.
I sometimes give them a non-named referral with a list of specialists, just to see who can see them best, quickest, cheapest, I guess.
Yeah, so sometimes it can be hard to get into certain specialists, particularly in regional areas. So the public tends to fall back on the public system. I know in Newcastle, it's getting hard to get into certain specialists privately, but that does, if you can, it usually is quicker for the patient. But as Franziska says, usually there's some sort of out-of-pocket expense for them, even if they do have private health insurance. Another suggestion we had was to take up, often new specialists when they set up will send out letters, so it's often a good opportunity to hit them up and have a chat.